Hi, I'm Sarah, and today we're going to be looking at the issue of embedding functional skills in the domain of health and social care. So the issues highlighted in the media by Darren Evans was his article on the TES website, which is linked at the bottom of this slide, about young adults being let down on basic skills in England, as a huge number of young adults across the developed world are leaving formal education with poor literacy, numeracy and problem-solving skills. And in accordance to a landmark study conducted by the Organisation of Economic Cooperation and Development, the OECD, they assessed more than 150,000 adults aged between 16 to 65 in 22 different countries, and to test their actual skills instead of estimating them based on their educational backgrounds. Their survey reported that Japan and Finland are the top in rankings for numeracy and literacy and problem-solving skills, whereas young people in England and Northern Ireland that were surveyed were no better than their grandparents. And in effect, the literacy for England and Northern Ireland was ranked at number 14, and numeracy was ranked at position number 16. The surveys basically reported that a significant number of adults don't possess these basic skills needed in today's world, and according to the OECD, the findings underlined that the need to move away from reliance on initial school-based education and the need to move towards a culture that promotes lifelong learning is needed. It urged the government to maintain public investment in skills, even though it's a difficult time for economic needs. There's more an importance that lies on improving skills. Okay, so why do we need these skills in the lifelong learning sector? The importance of numeracy and literacy, and the importance of IT in emerging technologies in further education is very important, especially for future to reduce future risk in unemployability and disadvantages in the workplace due to a lack of or reduced level of functional skills like reading, writing or working at percentages. In terms of ICT, it would be beneficial for both the educators and for learners to be using methods like blended learning and to create independence amongst one another, and also for using new technology as a social force for learners to express themselves by new means. So how do functional skills help us in health and social care? The new minimum training standards focus on 10 areas that have been designed to cover the key knowledge for health and care workers and set out what they should be covering during the period of induction in the first few weeks of employment. The roles of health care support workers and adult social care workers is the first factor. Second, their personal development. Third, effective communication. Fourth, equality, diversity and inclusion. Fifth, duty of care. Sixth, safeguarding. Seventh, person-centred care and support. Eighth, health and safety. 9, handling information, and 10, preventing infection and control. Okay, so the curriculum for how this will affect you as trainee teachers. In the future, for when as you now trainee teachers, how this is going to affect you in your futures. The curriculum for BTEC Health and Social Care qualification in 2014 and 2015 will be impacted by the new codes of training standards for health and social care support workers in England. This change will also have a great influence on the subject specialism being taught to students. A combination of vocational and functional skills are also to be embedded within the course, indicating the structure of the course, modules and assessment to be impacted by these changes. As a new member of staff in the field, you'll probably have to work towards a new policy and a new syllabus. However, that will be okay for you, probably beneficial to you, as you'll be starting afresh. However, for teaching staff that are already on the course, adapting to suit the needs of new policies could be a challenging experience. For further information, there's a link at the bottom of the slide and also at the first slide for the TES document by Darren Evans. So thank you for your time today. I hope this helped you in embedding functional skills into the health and social care domain.